Do you have IBS or irritable bowel syndrome and wondering, is there an IBS blood test? My name is Dr. Terranella, and in this video, we're going to look at IBS blood testing, some of the more standard IBS blood tests, and some IBS blood testing that you can use to help triangulate whether or not you're improving as you progress through your treatment for IBS. As I said, my name is Dr. Terranella, and if you're new to this channel, I just want you to know that I make these videos to help you go beyond the basics of your health, whether it's a confusing lab test, symptom, or diagnosis. I make these videos to help you get a better understanding of what's going on in your body. So if you like this kind of information on nutrition, health, hormone optimization, click on the like button and don't forget to subscribe to the channel to get more videos like this one. Now for a quick disclaimer. All right, let's look at IBS blood tests. In this video, we're going to look at and discuss IBS blood tests and IBS blood testing. First, a little bit about IBS in general. So IBS started as a diagnosis of exclusion, meaning that you rule out everything else that is known to possibly be causing your digestive symptoms. And if nothing is found, digestively speaking, you would be told you have IBS or irritable bowel syndrome. Now, this was always a bit of a simplistic test for anyone looking careful at people suffering from IBS. And for sure, some things were overlooked in the earlier days of IBS treatment. In the last decade or so, there have been some advancements made in terms of research and things that can point specifically to what's causing the underlying IBS. We have specific food triggers like high FODMAP foods and high histamine foods. We also have diagnostic testing and diagnosis of things like SIBO and post-infectious IBS. And on the horizon, there's even more possibilities in terms of diagnostic testing, microbial things to explore like SIFO and the VIROME and possibly even phage therapy. The problem has always been and still is to a certain extent with testing. Research has gone into finding different causes, and with that, they've developed tests that allow us to diagnose some of these things. Tests like the lactulose breath test can help us diagnose SIBO, which is a cause for many people with IBS. And also there's an IBS smart test, which looks at sources of post-infectious IBS or looks at whether or not you have post-infectious IBS. And this is an IBS blood test, by the way. And these can be incredibly helpful, but they do have significant cost burden, especially since insurance often doesn't cover them. They can run a couple $100 per test. This is an incredibly burdensome if you're just talking about getting the initial diagnosis, but you may have to run the test 2, 3, or even 4 times to have some absolute certainty on the progress of your treatment and to know where you stand. So what about other blood testing for IBS or other IBS blood tests? And that's what I want to discuss today is other signs that we can use to triangulate and understand whether or not you're on the right track with your treatments and or the diagnosis. For this, we can look at a research paper in my own clinical practice on testing for inflammation and how it's connected to IBS. We know for sure that the immune system is very closely related to your digestive tract, and that inflammation is one of the signs that your immune system is fighting something off or on a little bit more higher alert. The first evidence for an inflammatory component for IBS was reported back in the 1960s, showing that IBS patients had a higher number of mast cells in their intestinal wall compared to healthy subjects. More recent studies have described this in a little more detail with abnormalities in biopsies of their intestinal mucosa showing increased number of immune cells like lymphocytes, neutrophils, and mast cells compared with healthy controls. Traditionally speaking, IBS was said not to be an inflammatory process, and IBD was more of the inflammation or inflammatory digestive problem being more autoimmune driven. So even though we had this research, it was thought to be not really an inflammatory process in general. But we also know now, more so in the last decade or so, that the immune system is involved in cases of IBS from post-infectious sources. Of course, why wouldn't it be? The immune system gets involved in infections all the time, upper respiratory, and the same thing is true with digestive infections. In my practice, I've often seen the overlap in patients with IBS and elevated C-reactive protein, sed rate, And it's common to see people with IBS have sort of systemic inflammation with like fibromyalgia or other pain syndromes in the body. So given all this evidence, researchers of this particular research study wanted to investigate and see if there was an association between people with IBS and elevations in C-reactive protein. They also wanted to look at specific subtypes of IBS, like IBS-D versus IBS-C, and whether or not the symptom severity and the presence of these different IBS subtypes would show elevations in C-reactive protein. Their findings suggest that an inflammatory response in people with IBS can be identified in the blood, in showing that there is a more global response happening in people. This finding was especially pronounced in patients with IBS-D, and with higher symptom severity, the CRP numbers went up. The IBS-C patients did have higher CRP than controls, but they were overall lower than the IBS-D patients. The ranges that they saw in terms of the inflammation were somewhere around 1.5 for the C-reactive protein and as high as 4.5 on average. Where normal for this test would be somewhere around 1 or less than 1. They were having closer to 1.5 or 4.5. Does this mean that anyone with elevation above 1 or a CRP of 1.5 or 4.5 has IBS or IBS-D? No, of course not. But if this is the main thing going on with you, you've already ruled out certain autoimmune disorders or other inflammatory processes going on in your body, like infection, acute injury, blood sugar issues, and other things. This CRP blood test can be used as an IBS blood test in conjunction with other more specific targeted testing. So once a diagnosis of IBS is made and you're on a treatment course, you can use this CRP blood test, but you also have to make sure there's not other things going up. The CRP blood test is going to go up with any inflammation in the body. So it may be coming from your IBS, it may be coming from other things, but you can use this test to sometimes triangulate whether or not you're actually on the right track in terms of your treatment. So it's a very non-specific general test, but it can be useful. This and other tests like sedimentation rate can help guide you along the way, since these tests are relatively inexpensive versus doing another SIBO breath test or an IBS smart test or whatever test you're doing to diagnose what's going on with your IBS or digestive symptoms. These tests could be used as a general guide in addition to the main diagnostic testing. So how'd I do? Did that help you better understand IBS blood tests and testing and understanding where you're at with IBS in general? Hopefully it does. If you do have questions on anything mentioned in this video, please drop it in the comment section. I'm happy to try and answer your question. Thanks again for watching. We'll see you next time.